All right. So I want to talk for a minute about a little bit more specific effect of stress on the immune system, and that has to do with something called secretory IgA. IgA is a antibody that is produced by uh, it is produced by cells in our mucous membranes, in and around our mucous membranes. So we find a lot of secretory IgA in our oral cavity and a ton of secretory IgA in our digestive tract. And that's probably, at least from the context that I know, that's what I'm most familiar with. So secretory IgA's job is to kind of like protect, sort of be like a first line of defense our, um, for our immune system, but specifically our GI tract and our mucosa. So I think of respiratory disease, people who are getting a lot of colds and flus, people who have a lot of viral infections. There's some interesting data I found, and I don't have references handy, that show like a decrease in secretory IgA and an increase in susceptibility to the herpes family of viruses, which is pretty interesting, which is a fairly ubiquitous virus. So it's an important one. So it's found in high concentrations where you have mucous membranes. It's a first line of defense, and it can be measured. And I actually measure it a lot on a couple of the tests that I run frequently, especially specifically around the digestive tract, stool tests and some digestive health panels. They will measure secretory IgA, and I find it low a lot. And there's some evidence that shows that stress, actually, people who are really stressed make people more susceptible to disease, and one of the ways that happens is that stress decreases secretory IgA. So if somebody is very negative and they're very depressed and they're very stressed, they have a lower level of secretory IgA. Whereas simple, and this is that psychoneuroimmunology kind of piece of this, people who are very happy or their moods are elevated, oftentimes we'll see an increase in secretory IgA and then an enhancement in their immune system. So they're less susceptible to the immunosuppressive effects of stress in other situations if they have higher levels of secretory IgA. So it's pretty interesting. And again, there's other things that can affect secretory IgA levels, but again, in our college students, there was a study done at Princeton in 1989, but it was done at Princeton, and it looked at the evidence between student stress and immunity. And basically, what they did is they looked at college students' levels of antibodies, and they tested them over a period of time, and they looked at them basically the period of time they were looking at was around their final exams. I believe they tested their secretory IgA levels 5 days before they took their final exams, on the day of their final exams, and 2 weeks after their final exams. And as you would expect, that their secretory IgA levels were the lowest when they were taking their exams, which of course is the highest degree of stress, especially if somebody isn't prepared. And they've done this, they've retested, reenacted this study from different perspectives and to the same types of results. So, when people are happier, their secretory IgA levels are higher, and when they're stressed or unhappy, their secretory IgA levels are lower. So that's pretty interesting. So that in and of itself can be one of the connections. I mentioned also some other chemicals being affected, and there's a researcher by the name of Dr. Candace Pert. She's no longer alive, but she was a neuroscientist, and she worked all over the place, but she studied brain chemistry basically at the National Institute of Mental Health for a while. And she looked a lot at chemicals in the brain, messengers that are sending messages between cells in various parts of the brain and between the brain and other parts of the body. And we saw, and she named these I believe she named them, but they're called neuropeptides, which are these brain chemical message transmitters, for lack of a better term. And we see that that they are affected by stress as well. We know that macrophages are attracted to the neuropeptides produced by the brain. We know that relaxation and visualization can increase the production of neuropeptides. Endorphins are examples of neuropeptides. So it's very interesting. So essentially we can use some of these techniques like relaxation, visualization, meditation to increase the production of these neuropeptides, which then can make the brain ideally make even more of these substances and make the immune system potentially more effective. So that's super, super cool. Okay, and we'll come back to some of that stuff later on. So I guess we could say pretty confidently that there really isn't any illness, and even and we've been talking a lot about stress and chronic illness, but even acute illness, right? That is completely free from the influence of stress. Right now we're seeing even that acute illnesses because of your susceptibility, right? Your susceptibility is what makes you more likely to contract an acute illness, and even that is affected by stress. Another thing, which I think is super interesting, is the link between stress and our serum cholesterol, or our blood cholesterol. So blood cholesterol is kind of a hot topic, debated topic between those in integrative medicine and those in more conventional medicine. And for a long time, the conventional side of the street, agreed that serum cholesterol was the enemy and we should not have it and we should bring it down. We should take any kind of measures possible to lower it. That is starting to not be as popular a view. That being said, there is, there's reason for us to worry about it. The reason why people worry about it is we think that if we have a bunch of cholesterol floating around in our blood, it can accumulate on the walls of our blood vessels, which blocks the flow potentially of, starts off this like narrowing of our blood vessels, a condition we call atherosclerosis. And, that can decrease the blood flow. If this happens in the blood vessels around your heart, that can cause a heart attack. If the cholesterol accumulates in the vessels around your brain, it can cause a stroke, which I think I have on the next slide. So, anyway, this is hypercholesterol in the brain, or hypercholesterolemia is the fancy name for that. So what does that have to do with stress, right? So what we know is that that cholesterol is actually really important. Cholesterol is a lipid in our body. It's a waxy kind of fat-like thing that is made by the body. We can obtain it from our food, but we also make it. The foods that are higher in cholesterol are animal products, oils, fats, meat, poultry, red meat, dairy products. There's all sorts of different types of, but animal products are what we really think about. And obviously, if the body makes it, that means that it's got to do something good. And what it does is it's the precursor for all of our steroid hormones, of which we've talked about, cholesterol being one of them, which is interesting. And that's kind of where this conversation is going. So what I have learned in recent years is that, and I didn't learn this when I was in school, is that, okay, so what I just said is that cholesterol is this fatty substance, and we use it to make steroid hormones. So basically what happens is cholesterol travels around in the bloodstream, and it's carried and packaged into little protein fat complexes called lipoproteins, and those lipoproteins are essentially what actually carries the cholesterol throughout your body. Those are, I don't think I have a slide on this, I didn't put it on here. So you may have heard of low density lipoprotein, or LDL, which oftentimes is referred to as the bad cholesterol. and that's the one we kind of worry about. Then you have the HDL, or high density lipoprotein. That one's called the good cholesterol, and that one we worry less about. The liver's job is to kind of remove cholesterol from our body. So where I'm going with all of this, you might be wondering, sometimes it's not clear, but I mentioned a minute ago that cholesterol is the building block of all of our steroid hormones. Our steroid hormones are estrogen, testosterone, progesterone, cortisol, and aldosterone, as well as DHEA, and but those are the big ones. So I just said cortisol, and hopefully that one is something that you're like, oh, I've heard about that before. We've talked about cortisol. So I think it's safe to assume that if you're dealing with stress constantly, your body is going to need cortisol constantly, and you're going to need to make it out of something. And where do you make it out of? You make it out of cholesterol. So what I just started to say a minute ago and kind of lost track of my thinking was that I have learned recently that they call cholesterol what we refer to as an acute phase reactant, LDL cholesterol in the blood. What that means is it goes up in times of an acute situation. I want to say acute stress, but also inflammation. And so if someone's very inflamed, which is a type of stress in the body, or they're very stressed, then I think we can extrapolate. And I don't have any research handy right here in front of me to substantiate this, but I know I could find it, that if you need more stress hormones, then we should think about making some more. And where do you make it? What do you make it out of? You make it out of cholesterol. So those of us who are running around with like high cholesterol, and this is what I've seen, like someone who doesn't seem to have a lot of cardiovascular risk factors, everything else looks more or less normal, but then they have high cholesterol. My question now is, how stressed are you? Like, what is that possibly? And again, I think you have to take this on a patient-to-patient person, or I should say a person-to-person basis. But is it possible that that elevated cholesterol, blood cholesterol, is elevated because of the fact that you're dealing with stress, and we're just using that cholesterol, we're making it, right? The liver makes it, and absorbing it from our bloodstream, but the liver makes it, and you're having, it's making it for a purpose. And my question to you is, do you think that that is a reasonable assumption? Could we be making cholesterol because of the fact that we need more cortisol around? So I don't know, but I think that's something we should think about. In the video I'm going to post for you guys, there's some talk about hypertension. Hypertension, I think, is a very safe. Hypertension as a potentially stress-related disease is not a hard jump to make. Hypertension is high blood pressure. The reason why we worry about high blood pressure is the pressure. So how blood pressure is measured is it's the force of the blood in the blood vessels as it pushes against the walls of the artery. So someone with high blood pressure means they have a lot of blood in there, and it's pushing hard against or the blood vessels are constricted, and the blood that's there is pushing hard on the walls, and the pressure goes up. High blood pressure has been linked to all kinds of things. We've been talking about fight or flight. We know already, we've talked a lot about the fact that stress causes our arteries to constrict, causes our blood pressure to go up. We've talked about that, right? That is something we know about. And we know that if you're a hot reactor, if you're in that 25% of the population, I know I'm certainly in that camp, that we are more likely to have elevated blood pressure. So when someone's blood pressure is elevated for a while, it puts them at risk for hemorrhage, especially of any vessels, but especially vessels where the pressure is high, and the pressure as it leaves the heart moves into our aorta, and then it kind of has a straight shot up to the brain. Your blood leaves your heart at the highest pressure there that in the circulatory system, and so it moves into the brain at a very high pressure, and then those vessels get smaller and smaller pretty quick. So if the pressure that's moving into the brain, the blood that's moving into the brain is moving in at a higher pressure than it should, there's a potential to blow out the walls of those vessels, rupture the walls of those vessels, and that can cause a hemorrhage. If you have plaquing, cholesterol stuffed to the walls, potentially, you can have a stroke, which I think is going to be on another slide. If an artery ruptures in the vessels that wrap your heart, and or if there's a narrowing in the vessels that wrap your heart, you cannot get enough blood flow to your heart, which can cause a heart attack, which is what a myocardial infarction is. Normal blood pressure is read as a fraction, with the systolic number on the top and the diastolic number on the bottom. We've talked about this before. Normal blood pressure is 120/80. We consider anything like around 135/85 as pre-hypertensive. And high blood pressure is diagnosed, and this bounces around, but currently we're saying 140/90. So we know there's all sorts of factors that can increase, but I think stress is a big one. Men are more often hypertensive than women, but that's not always the case. Women around menopause tend to be, their blood pressures tend to go up. You can see it within women. White women have the lower incidence of hypertension, I would say probably before menopause. Heart disease in women, though, is still a really big deal, right? Heart disease kills more women. Heart disease kills more people than any other disease, and hypertension is high on that list of things that set people up for heart disease. Okay, and we already kind of know. I think we understand the relationship between stress and hypertension. So we're saying that blood pressure can go up with stress, cholesterol can go up with stress. So we want to think about emotional stress being a major risk factor for both strokes and heart attacks, cardiovascular disease in general, hypertension, etc. And I think there's a lot of work we can do around that, right? We can do a lot of lifestyle stuff that decreases blood pressure, that, losing weight, stopping smoking, exercising more. But I think what we don't do, at least from the clinical perspective, we see someone's blood pressure's up and we talk about all of those things. But what I don't think we're doing a very good job is like asking people about their stress. And there is a doctor who wrote a book. His name is Herbert Benson. He's a cardiologist, and he wrote a book on meditation. One of his books, he's got a lot of them, but one of them is called The Relaxation Response, and it teaches the technique around how to kind of try to control blood pressure with relaxation. There's a company out of somewhere up where you guys are. I don't remember. I want to say, I don't remember where it started, but it's called Heart Math, and they have like an app, and they have all this stuff that you can start to use meditative techniques to kind of like bring down your heart rate and ultimately bring down your blood pressure, all kind of around relaxation. We'll talk some more about that later on. I should have had this up. So these are some other reasons that can cause hypertension, but stress is the topic of our class. And I think that that's something that needs to be addressed. And that is, as someone who works clinically, that is something that the conversation I'm trying to have more and more and more of. And this class is helping me with that because, it's a lot easier to talk about all these other things, but it is not always easy to talk about stress because that's like the one thing. And I tell my patients this. It's like, this is the one thing that is more likely to move the needle than any other thing. And I think I've told you guys that in the beginning of this class as well. But it's a hard conversation to have, and it's because it's a hard fix. People don't want to have to do, in a lot of people, not all people, don't really want to have to do the hard work of like because stress is complicated, like the sources of stress and where is it coming from, and all of that. And now even with our genetics, like maybe you're kind of programmed to be more susceptible to stress. How do you reprogram, right? That's hard work. It's hard work if you're a hot reactor, it's hard work not to react. How do you do that? We have to learn these techniques that we're going to talk about: yoga, meditation, exercise, find what works for you, that is some way to diffuse. But a lot of us don't really want to do that work, right? There isn't a magic pill to make the stress go away, unfortunately. And so I think that's a conversation we need to have, right? I've mentioned stroke already. Again, this is a lack of oxygen to the brain, or it could be, or it is a lack of oxygen to the brain, and it's either because a blood vessel ruptures or it's blocked. Sometimes they use that term apoplexy if someone's had a stroke. And again, stress is not the only thing on that list, but it's on their list. High blood pressure, which we know is related to stress. Diet, which can also be related to stress. That's a conversation for a different day. But that's another thing to think about. When somebody has a stroke, there's impaired function of the brain, right? So it can be motor, it can be sensory. There's lots of different types of stroke, and to say that those are the only symptoms is doing a disservice, but those are the common symptoms of stroke. Motor dysfunction, speech dysfunction, some sort of paralysis. Usually it's on one side of the body or the other because of the fact that the motor cortex is on both sides of the brain, and if wherever the bleed or the blockage is will affect the motor aspect of the other side of the body. So, for example, if a vessel ruptures on the right side of the brain, the motor symptoms generally are on the left. Coronary heart disease, we've been talking about this. Again, this is a big one. Again, more cardiovascular disease kills more people than anything else. And I think there's pretty consistent data that supports the theory that stress is related to coronary heart disease. So I think that's enough to say. There's other risk factors. High cholesterol, which we also know is associated with stress. Hypertension was associated with stress. Cigarette smoking, why do people smoke? Usually because they're stressed. I think we can, the more I think about it, the more I think really stress is our problem. It's the big one. It's the big thing. We talked a little bit about this in our very first lecture. The video I post is going to talk some about this. I think all of the things on the slide we've talked about, but and I'm going to do a whole lecture on the gastrointestinal system in coming weeks, because I think that's a very interesting and a very important topic to have. But we definitely know from the work of Hans Selye, who, remember, was the guy who really horribly mishandled the rats and dropped them and scared them and did all those things. What happened to all those rats that were under his quote-unquote care? They all developed ulcers, right? That was the thing, and that was his thing, thinking that ovarian hormones cause ulcers. Nope. Ulcers are not related to ovarian hormones. They are related to stress, right? And they'll show up anywhere in the GI tract, in the esophagus, in the stomach, in the duodenum, anywhere. And what we know for sure is that during stress, norepinephrine, which is our fight or flight hormone, causes capillaries in the stomach to constrict, which basically causes less mucus there, right? Remember, you got a lot of mucus that protects it protects the tissue from the acid that we produce in our stomach. It's supposed to produce there. Stress decreases the acid, and then unfortunately also decreases the mucus, and also increases the hydrochloric acid. So you've got more acid and less protection, and a big time problem. And also we might have that crazy bug, Helicobacter pylori, that can inflame the GI tract even more, making more acid. So if you're stressed and you have H. pylori, that is a double whammy, right? That's a recipe for destruction of the walls. That's a recipe for an ulcer. There's some drugs that can cause irritation as well, which is not really the topic of this class, but aspirin and other NSAIDs, non-steroidal anti-inflammatories, can cause inflammation, or can cause some problems in the mucosa of the stomach as well, and increase someone's risk for ulceration. Migraine headaches. Now, migraine headaches are in terms of clinical practice, are a very difficult condition to approach. We don't really know what's going on with migraine headaches. Historically, we've thought of them as vascular headaches also, meaning that the vessels in the arteries that are going into your head usually will constrict and then dilate, and that's where we thought was where the migraine came from. When it constricts, that's when people have their prodrome. A prodrome is and not all, but a lot of people with migraines have these. And interestingly, people with seizures have the same kind of a situation where they have this prodrome period where there's there's some unique situation for that person that tells them they're going to have a migraine. Oftentimes their vision will tunnel, they'll become super sensitive to noise or light or whatnot. Sometimes there'll be flashing lights. It's unique to the person. People with seizures usually have a similar kind of a situation. So before they seize or before they get the headache, there's some kind of symptom, physical symptom that's going to tell them. It's usually the same kind every time. And we think that the constriction is what kind of brings that on. And then when the vessels dilate, then that causes chemicals that are kind of being released near those vessels will be released, and they'll irritate the nerve endings, and that will cause the pain. They're usually migraines are kind of classically on one side of the head, and they usually last somewhere between 4 to 12 hours, with the average being at about 6. Now, people who have migraines oftentimes will say they have a trigger, and one of the big triggers, it's not the only trigger, but one of the big triggers is stress and tension. Hormones are another big one for women. So not every person that I think have migraines necessarily we can say conclusively that's a stress-related condition, but stress is a big one. And in those individuals that stress is what seems to be a big part of their situation, then relaxation techniques can be really helpful. Biofeedback, meditation, autogenic training, which I think we talked a little bit about and we'll talk more about later. Tension headaches are another kind of headaches. Headaches are a big deal. There's a lot of people with headaches. Tension headaches are caused by stress in the muscles, which also oftentimes accompanies stress in the brain. Right? So if you get really stressed, which I'm sure some of you recognize, we tend to contract our muscles. We've talked about this. And that muscle tension can then put pressures on our vessels and or our nerves, and that can affect the head, the jaw, the neck, etc., and that can cause a headache. So again, massage, relaxation, we use medications for not that effective for both migraines and tension headaches. The medications are, marginally effective for most people. But dealing with what's causing them, and in the case of tension headaches, massage is really helpful. Heat on the tense muscles, and then obviously trying to not get the tension to begin with, I think is a really good technique. So relaxation techniques I find to be really helpful. All right, I want to talk a tiny bit about cancer, and I do this kind of reluctantly because, again, I think this causes a lot of stress for people, and I'm trying not to do that. And I think that the evidence is it's just such a complex situation. But I definitely do think that stress management does play a role, and okay, let me just kind of say a few things about this. So I mentioned earlier that cancer is kind of this like out of control multiplication of cells. It's abnormal cell division. And these cells divide, and they divide like crazy, and they divide, in an uncoordinated way. And they oftentimes, because they're so metabolically active, they kind of rob the host, the person, of nutrients. So as cells divide and divide and divide and divide, that can lead to tumors. It can lead to organ damage. It kind of depends on the type of cancer, and there's a bunch of different types of cancer, and they all kind of are unique in their own way. We don't really know what causes cancers. I don't know that I would go as far as to say stress is directly going to cause cancer, but we do know that stress affects the immune system, and the immune system's job is to recognize cells gone wild, and so that's where I think the focus should be. I think there's other things that are causing the cancer that we call those things carcinogens, and there's lots of things to choose from in that department, right? Unfortunately, we are in an ever toxic environment, And I think that we are constantly being exposed to potential carcinogens. I don't think that I know that. And there's lots of evidence to support that. And if you're interested in what some of those things are, I would encourage you to do some investigation. But where I like to go for a lot of, you know, how I kind of think about it and how I talk to people about it is in terms of toxicity in the environment. And this is an area of a lot of interest for me. And it's a big part of my clinical practice. I say try to change what you can, try to intervene where you can, because it can be very overwhelming. We can't stop breathing, we can't stop eating, we can't stop showering, but we can stop, consuming things that are known carcinogens, like some of the pesticides in our food. You can try to choose organic whenever is possible. You can and this is where I usually start with people, is you can pay attention to your things that you're applying to your body every day, shampoos, lotions, makeups, those kinds of things, so what you put in and on your body, that in and of itself. And there's a lot of research to show, like you're slathering some, lotion on, a couple times a day, and they'll measure in the urine metabolic byproducts of potential carcinogens. There's labs that test for this and whatnot. So try to avoid those kinds of things. And where the stress comes in is stress reduces our white blood cell count, right? Stress, specifically in this context, the cells that we really rely on are the T lymphocytes. Remember, those are the ones that, engage in cellular warfare. They pop holes in cells that are either infected or doing things weird. And these cells are weird, right? They're not infected, which makes it a little bit harder for our immune systems to recognize it, but they are acting funny. And so the T lymphocytes and different varieties of the Ts are the ones that we rely on to, the T lymphocytes and another type of cell that I didn't talk about, which are called the natural killer cells. Those guys are the ones we want. And we know that stress suppresses those. So in a situation where we have chronic stress, that might then set us up for the chronic inability of the immune system to essentially mount the right attack and prevent the division of these weird cells. So that's where I think the discussion of stress needs to come in. Now, so I would say that people who aren't very stressed are less likely to develop cancer. I won't say that it's because there's so many other variables. It's too hard to say that. But I do know that people who do have cancer, of course, that's an incredibly stressful diagnosis, as I can imagine, you would imagine. And that is, I think, a place to intervene, to try to manage the stress that is a consequence of the diagnosis. So and there is some work around that, where they'll do like a lot of, positive attitude, visualizations, all these things to kind of minimize that, and the reason for that is to enhance the immune system's ability to fight this. This I took out of the book that I had some reservations putting this in here, but I think this is just a characteristic of a cancer-prone person. I'm not sure I should have said that, but characteristic of a person whose immune system is not potentially able to really do everything it can for them, and that can set them up for infections and or cancer, which again we don't really know for sure at that respect, but it can help make them less able to deal with the diagnosis once they have it. And so these kinds of things that we think about are people who cannot forgive. They hold on to everything. They feel sorry for themselves all the time. They are disconnected interpersonally, and this is one of the biggest issues. And this is something that in that YouTube video I'm going to put for you guys up, he talks about at the end, which I think was fascinating, and he talks specifically about social media, which I have a very keen interest in, and I have a mostly hate relationship with that. I want to say love-hate, but mostly I think it's not doing great things for us, and he talks a little bit about that, which I think is interesting. People who have a poor self-image. All right. Again, a little bit, I talked about this before, allergies, asthma, and hay fever. These are allergic disorders. Again, this is a situation where we need our immune system to be able to kind of manage this. The term antigen I used is the foreign substance that irritates the body. An antibody is something produced by specifically the B cells of our white blood cell line to fight the antigens and stimulate the release of chemicals, one of which is histamine. Those come from the basophils. So essentially the relationship between stress and allergic reactions, I know this is going long this week, is we see a decrease in the number of T lymphocytes. We see an increase in the secretion of cortisol, and we see a decrease in the ability to withstand an antigen. So all of those. So again, if somebody has asthma, if they have hay fevers, if they're very allergic, there's something that they're responding to. But then we also want to look at we want to look at stress, and we want to see how that factors in. Here's a funny little cartoon I found, just kind of showing us the effective defense and the disease development. Right. So if you just see, when somebody's immunological system is robust, they have an effective defense situation going on. They can't, but with those problems that we've talked about, whether they're autoimmune diseases, whether they're allergies, whether they're potential cancer, cells gone crazy, they can't get past the immunological system because it's working too well. And so it can't get to the rest of the body. And the T lymphocytes and or the B cells, depending on what the situation is, would go after them. But if somebody's busy being stressed, then the defenses are down. I think that's the most important thing to think about. The defenses are down, and therefore we are more susceptible. Okay, I already talked about this. This is, again, autoimmunity. This is just the one example I gave was rheumatoid arthritis, but you could put any number of them. Hashimoto's, Graves' disease, all sorts of them. The faulty functioning of the immune response, right? That's where we really think about. So there is a genetic susceptibility to autoimmunity. It's not just stress, but stress can really precipitate it. I think that's pretty well substantiated. Back pain is a really interesting thing. So back pain can be due to a lot of things. It can be caused by weakness in the muscles, by bracing, which we talked about early on. Another kind of like more esoteric perspective, we hold a lot of our emotional stress and memories in our pelvis, especially women, but not only women. And so that's something when somebody has back pain a lot, that's a question I oftentimes want to ask, because I've seen that to be a big issue. So back pain in and of itself, chronic back pain, we want to have the conversation around perceived stressors, work stress, mental distress, family stress, depression. Again, people with, and we haven't had this conversation, but people with pain, chronic pain, that's a stress-related illness. That's a stress-related disease, right? And it wears on the body and ultimately ends up causing that taxes their energy reserves. So we want to have that conversation early on before we start to get into this, they're not producing enough cellular energy anymore. Another relatively common and very much associated with stress is TMJ, or temporal mandibular syndrome. These people have, and the reason for that is oftentimes they're grinding their teeth, they're clenching their teeth, and I'm sure you've all experienced that. If you're stressed, you tend to clamp down. I know when my partner is really stressed, I can hear him grinding his teeth when he's asleep. And it always is when somebody's really stressed. And so people who have TMJ, that they might not oftentimes know that it's the TMJ, but instead they might think that they have migraine headaches, which they do develop, but it's because of the clamping down. They might be dizzy. Their teeth might hurt. In some cases, they'll wear their teeth down. It will cause all kinds of dental issues. They might get earaches. They might get tinnitus or ringing in the ears. And again, this is specifically due to the stress. So stress is a big part, not the only part, but a big part of TMJ. Okay, a little bit on obesity, which is generally, we think of it as somebody with a BMI of 30 or more. So there's lots of things to think about here. There is a neuropeptide. It's called neuropeptide Y, pardon me, and its receptors, the receptors for neuropeptide, seem to play a role in human fat, the growth of human fat cells. So when somebody has a lot of stress, this neuropeptide increases, and that can cause the fat cells to get bigger. What else do I want to say about that? So I said that stress. Okay, so okay, I guess that's all I was going to say. I mean, the diet definitely plays a role in it, but it seems like the diet, if somebody's got a high fat, high sugar diet, they oftentimes have, obviously more abdominal fat, but they also seem to have more of this neuropeptide Y, along with its receptor, which is a neuropeptide Y receptor. And that might be what is kind of causing this like feed forward situation of more fat tissue, more bigger fat cells, and ultimately more belly fat, excuse me. We'll talk a little bit more about all of that later on. All right, so finally I want to talk about PTSD. PTSD is complicated and prevalent, and it seems like more and more and more prevalent. So PTSD is a situation that develops in people who have experienced some kind of psychological or physical event that is interpreted as distressing. This is, and then it hangs around in there. This is the amygdala. Remember that part of your brain? This is like a hot amygdala. The amygdala remembers all of this, and it is quick to ignite by anything that's perceived as stressful. The symptoms of PTSD are myriad, all sorts of different kinds of things: flashback nightmares, anxiety, behavioral issues, uncontrollable thoughts, combative behavior, etc. It goes on and on and on. The thing about PTSD is I think it's really common. I don't know where we are with numbers right now, but I think we can say pretty comfortably that it's affecting more than 10 million adults, American adults. I think that somewhere along the lines I read that the epidemiologists have reported that most people are going to experience a traumatic event in their life, and about a quarter of them will develop PTSD as a result of that. Some people go as far as to say that this is one of the most prevalent mental disorder, even though a lot of people don't get treatment for it. So again, I think the important thing is that this is perceived stress. So whatever the situation was that initially was stressful, they basically keep reliving it. There's all sorts of things that trigger it, and it continues to, it's like they relive it and relive it and relive it and relive it all the time. I guess that's an easy way to think about PTSD. I'm not an expert on PTSD by any stretch of the imagination. But we need to kind of get a handle on this because it is a serious source of stressors for the people who actually do have PTSD. So there's lots of ways to go around that, there's lots of I'll get to that. But I mentioned some of the categories of PTSD. One is reliving the event. The other is doing all sorts of things to avoid having to go through it again, right? So they kind of emotionally detach. They become, kind of numb to just emotions in general and emotional situations. They lose interest. They can look depressed. They can go so far as being very withdrawn, avoiding people, places, especially places or people or situations that might precipitate these memories. They have, because of where it affects the brain, oftentimes it affects their ability to concentrate. It can affect their memory, their short-term memory. It can make them hyper vigilant. I think that's a big one. It can make them irritable. It can give them cause a lot of issues with sleeping. How it's usually handled is with medications, although I don't know that they're very helpful in many cases. Therapy is a really good thing. There are, and I don't know much about this. I work with a psychologist in my office, and I was talking to her about this, but they do some kind of, there is some sort of interesting work around virtual reality and kind of like slowly exposing the person to virtually to the event that precipitated the PTSD. I kind of think of that as a desensitization sort of a situation. So again, this is not my area of expertise, but I know that stress is this is a huge stressor. And so people who have PTSD are like constantly under stress. There's some other things that are associated with stress: increased risk of miscarriage. Although there's a lot of other things that's very broad. There's a lot of other things that can do this. Sports injuries. People who are more stressed tend to get injured more often. So that's kind of was an interesting thing I found. All right. Anyway, this was a very long lecture this week. Oh, this I found. Oh, I forgot to write down where I found this. Excuse me. There was a site. I'll try to find it again that I liked, and I stole this graphic, and I meant to put the tag on there, and I forgot it. I'll find it for you because it was like a nice website for stress. But here's sort of another, we've talked about a lot about these, but I just kind of thought this was a nice graphic on some of the way the bodies react to stress. All right, so that was a lot. I'm going to put, I know I promised a discussion last week and I didn't put it up. I'm still trying, we just finally got to the census date and we've been adding people and dropping people. So I was sort of waiting for the rosters to get settled out. And now I think we're there. So I'm going to put a discussion topic up for you. And I'm going to post the little video, and I'm going to have you do a little discussion post because I want to hear your thoughts on the little video. It's about an hour, so, and it's, again, Dr. Robert Sapolsky, who I adore and love, and I just found out is speaking at a conference I'm going to this spring, and I cannot hardly wait. But anyway, I think you'll find it very interesting, and it's kind of a sort of a summary of his book, Why Zebras Don't Get Ulcers, and he talks about just some very specific conditions and how that's related to stress. It's a very engaging conversation. So you will hear from me later. Have a great week. Try to take some deep breaths and manage your stress. Oh, so this is week 4. In week 5, you guys are going to have your first test. It will be there for you for a whole week. You'll have a whole week to do it. And it's going to be mostly multiple choices with a few short responses. And this is a class on stress, which I'm trying not to cause you more stress. So use your notes. Don't do it from memory. You'll have lots of time. This class is really for you guys to learn about this, not to cause a whole bunch of trauma in your academic setting. So I'll send an announcement with a little bit more information about that this week. Okay, you guys, take care.